Do you know that about one of every three Canadians might have diabetes or prediabetes and don't even know that? Hi, good afternoon. I'm Dr. Abdalla Ahmed, your friendly family doctor from Winnipeg. Today I'm going to speak with you about something that affects millions of Canadians and often goes unnoticed, which is prediabetes. What does prediabetes mean? Prediabetes means that your blood sugar levels are high. They are higher than normal, but they are not high enough to be diagnosed as type 2 diabetes yet. You can consider it as a warning sign and an opportunity to change for prevention. What are the causes or risk factors for prediabetes? You can think of them as three groups of causes or risk factors. The first is genetic, your family history. Your family had diabetes and prediabetes. You are more likely than average to have high blood sugar levels and be pre-diabetic, and if not addressed appropriately, then you will become diabetic. The second group of risk factors or causes actually are what we call modifiable ones, the lifestyle related ones. Poor diet, physical inactivity, and being overweight, especially belly fat, are risk factors for getting prediabetes and eventually diabetes if not sorted. The third group of causes and risk factors are things we cannot change. For example, age. If you are above 40, you are at risk of being pre-diabetic. Other thing is ethnic origin. Certain ethnicities are more likely to get pre-diabetes or become pre-diabetic than others. The third bit is having other medical conditions like high blood pressure, high cholesterol levels. They also increase your risks of getting prediabetes. In addition to this, if you were pregnant before and you got what we call gestational diabetes or pregnancy related diabetes, your blood sugar levels went up when you were pregnant and it settled down later, this can increase your future risk of becoming pre-diabetic. What are the symptoms of prediabetes? Most people with prediabetes don't have any symptoms at all. They are asymptomatic. And that's why it's important to do what we call screening. Check people without symptoms for certain medical conditions. One of them is prediabetes. Occasionally, people might get some symptoms of high blood sugar levels. Those can be things like feeling tired all the time, fatigue basically, or excessive thirst, the need to drink lots of water and fluids, and passing large volumes of urine day and night, or basically getting blurred vision. But because most people are asymptomatic without any symptoms, that's why it's important to check people who are at risk and measure their blood sugar levels to see if they are diabetic or not, or pre-diabetic or not. How can I know if I am pre-diabetic? There are three tests that can be used to check for pre-diabetes and diagnose it. The first one is measuring your fasting blood sugar levels. You fast overnight, about 8 hours, and then you get your blood sugar levels tested in the morning, first thing before eating or drinking. That will tell us how high it is and if you fall in the normal range. If you are pre-diabetic in the borderline between normal and diabetes, or you are high enough to be considered as diabetic or having type 2 diabetes. The second test we use is something called hemoglobin A1C. You can think of it as measuring your cumulative blood sugar level. It assesses your average blood sugar level over the last 2 to 3 months and tell us what was the average or how high was it. And again, we can see if you are normal, it wasn't high, or if it was high enough to be pre-diabetic but not reach type 2 diabetes diagnosis threshold, or if it is high enough to be considered in type 2 diabetes diagnostic range. The third test is something we don't usually use in primary care, but can be used, for example, for pregnant women to diagnose diabetes or pre-diabetes, something we call oral glucose tolerance test. You fast Then you get some sugary drink or basically loading dose of sugar. Then your blood sugar levels are measured at certain intervals. First, of course, you do the fasting one, then after 1 hour or 2 hours. And this will tell us how well your body processes glucose and if it is in the normal range, pre-diabetic or diabetic range. But again, because it's mostly a silent condition, it's really important to get tested for it if you are above 40 years of age or if you have any of the risk factors I mentioned earlier in this video. How to reverse prediabetes? There are many things that can be done to reverse prediabetes successfully. They include healthy eating. I would suggest basically Canada Food Guide as a good reference for that. It's a government website. It advises on healthy food and healthy diet recommendation. It has also suggestion for meals, preparations, and so on. And actually it has informations in multiple languages in case, for example, English was not your first language or you wanted to share this with a loved one who can't speak English or struggles with reading that. The second bit is regular exercise. 150 minutes per week is really good. About 30 minutes exercise 5 days a week. The third bit is basically optimizing and losing weight. So losing even 5 to 10% of the body weight can have huge impact on blood sugar levels and basically on prediabetes. The fourth one is to quit smoking. In many cases, basically prediabetes can be reversed successfully or even delayed for basically years. I know the big question will be when to speak with my doctor about it. My advice is to speak with your family doctor about this if you are at risk. The risk factors we mentioned earlier in the video, whether it was family history, lots of cases in your family of diabetes and prediabetes, or lifestyle related factors or other factors. Or if you are not sure about your blood sugar levels, or basically if you had some symptoms, the symptoms we mentioned earlier, feeling tired all the time, feeling excessively thirsty and drinking lots of fluids and passing large amounts of urine, or even having episodes of blurred vision, speak with your family doctor. It's important to get the screening done and to get basically the blood work up to date and see if you have anything. In summary, prediabetes is a wake-up call. It's not a life sentence. Small changes today can prevent serious problems in the future. So speak with your family doctor, get checked, and for more health tips and information, please visit my website, follow me on the social media, or follow up my YouTube channel. Thank you for listening. Stay well, stay healthy. Until we speak again.